Good afternoon. Greetings from the Institute of Global Professional IGP Bangladesh. Thank you all for joining with us and staying with us till the end. Honorable Knowledge Seeker, today I am your host for the afternoon. My name is Badhun Dash. I am from Bangladesh, dear Knowledge Seeker. I am proud to be associated with IGP as a global member. IGP is a social and ISO certified international training institute. In 3 years, we already served 3 million plus knowledge seekers from 100 plus countries. IGP is internationally recognized and globally accredited. We are connected to more than 250 plus profession and 4,500 plus organizations. Institute of Global Professional IGP is a training faculty for skill development which was founded in 2020 and is generally competent candidates to meet demand in the global labor market by providing professional qualification. The Institute of Global Professional is an education institute that provides social work globally recognized and reportable. It serves student and community resource providing holistic social work and education. We believe that it's not effective to increase finances by acquiring formal education. So we provide effective training and consultation to generate professional generation all over the world. We distribute our services locally, nationally, and internationally to students, job seeker, job holder, and also for the learners, the respective campus location and distance learning platform. We are a markup and dependable institute. ICP is one of the famous online institute. Our vision is education is not a business product, it's a part of our human rights. Based on our vision, we are trying to reach of the world for free webinars, seminar, courses about quiz competition, mentoring, and counseling, etc. On the other side, we are also trying to serve more than 100 premium services like create own portfolio website, resume builder, cover letter, motivation letter, and a wall knowledge platform for gathering general knowledge which can update all day. Kids learning game, website free courses, converter size, and many, many more. We help empower you to learn to meet their expectation and dream and become highly skilled people. We implement training programs, webinars for youth and learners by professional trainers, speakers, and coaches. Our sessions are conducted by globally renowned professionals who skill to all kind of youth and to promote all education of communities. To ensure excellence and in-depth instruction, we arrange with qualified trainer, speaker, and staff. We provide free services to more than 3 million knowledge seekers. The last we have affiliation with universities and organizations in 70 different countries. Virtual more signing with many colleges have been working to create a legendary generation for future scholars who will be accountable. We are constantly prepared to assist all knowledge seekers with valuable services. Pro- Spreading knowledge is crucial for the Institute of Global Professional. We believe that knowledge is love and light and vision. So we try to understand the needs of today's generation and we serve them with good research and practice methods. We must have a genuine collaboration. More diversity, growth, and innovation are required to lead the session with professionalism, passion, and integrity. IGP members are committed to offering effective best quality service and continual improvement so that individuals who seek information can improve their skill level and below. Before we move to the next, let me remind don't forget to share, tag, and mention your friend in the comment box. The support is available for us. Thank you. Before we move to the next, let me remind don't forget to share, tag, and mention your friend in the comment box. Your support is very valuable for us. Thank you. Moving to the next, with your continuous support, we already completed 1,213 webinars successfully. Wow. Moving to the next, with your continuous support, we already completed 1,213 webinars successfully. Wow. At present, we are going to start our 1,214 program name is Mental Disorder and Treatments Part 2. And today our speaker name is Hajara Sadam. Before I hand over the stage to ma'am, I want to share a very little bit about our speaker. Clinical psychologist and counselor, psychologist and senior counselor, Islamic Care and Counseling Center, clinical psychologist, Garments Hospital psychologist and senior counselor, Al Musa's Adha Foundation lecturer, Colombo University and Metropolitan University, and now very important moment for me to invite our speaker to IGP with her presentation. Now, very important speaker to IGP with her presentation. Hello, ma'am. Hello, ma'am. Good afternoon.
Hi, hi. How are you? Hope things are good with you.
How are you, ma'am?
Can you hear me well? Am I audible?
Yes, ma'am. I can hear you. Yes, ma'am. You are
Okay.
audible.
Yeah. So, can I start?
Okay, ma'am. Then you can
Sorry.
start.
Okay. Thank you. Thank you so much for all your support. Hi, guys. Hi, everyone. This is Hajra Saddam from Sri Lanka, clinical psychologist and international trainer. So it's so nice to see you all today. I can see Isaiah, and then I can also see a lot of people on board. Then Christina. Hi, Christina. How are you? Aaron. Good afternoon, Aaron. Isaiah, I can see that you're not well. So I pray that you get well soon. Hi, Evelyn. I think we have met before also. So, Rosalinda, how are you? Um, January, how are you? I hope I'm pronouncing all your names correctly. Cameral, so hi. It's so nice to see you guys on board. Thank you so much for joining with me today. So I hope it's going to be a remarkable session with me, and I'm sure that you're going to enjoy and learn a lot in this platform today. So today I'm here to give you a very brief introduction about abnormal psychology and basically the mental disorders. So we're going to discuss about mental disorders because from recent times I can see the field of mental disorders and psychology is actually emerging and it's growing fast. But at the same time, we are having a lot of myths about the field. There's a lot of myths about mental disorders, abnormal psych, and how to identify mental disorders and how to spot out abnormality. So just thought of starting with that. Just thought of giving you a brief introduction about the difference between normality and abnormality and how we can identify mental disorders and in which basis we can categorize mental disorders as well. So we are going to debunk the myths. So there are a lot of myths in the society. So I'm pretty sure that you also must be aware. There's a lot of stigma, a lot of myths, a lot of misconception about mental disorders. So today we are just going to talk about it, and we're just going to break all the myths and misconceptions about mental disorders. So before I begin, I would like to have a interactive session, guys. So please do interact with me through the chats. So I'm so happy to connect with you guys. So I would feel so happy if you can just reply to my questions so that I will feel connected to you wherever you are. We are just under one roof. We are just under one work. So definitely we are connected to each other. So it's a really good opportunity for us just to get connected. So please answer my questions in that way. I will feel connected to you definitely. So I would like to start off just with a very small activity. So I've given 4 pictures. Okay. So I just want you to observe the pictures and you should tell me which one do you think seems to be like abnormal. So there are 4 pictures out of these 4. Which one do you think seems to be abnormal? What is abnormal? Which picture seems to be abnormal, guys? Which picture seems to be abnormal? It's the first, second, third, or the fourth. What do you think? Okay, I'm waiting for your answers. Um, I know that it will take little time for you to answer my question, but anyways, I would just like to highlight something very important here. Generally, in the first look, we try to decide on something, and we just try to, think that people are they are abnormal through their looks. So it's very common, right? So if somebody is not dressed properly, if somebody has a weird look, and when somebody has a very unpleasant appearance, or maybe if they're not neat, tidy, we have this way of stigmatizing people, and we think that they're abnormal based on their appearance. And sometimes we also think that they're abnormal based on their behaviors. Sometimes we think that they're abnormal when they when they violate a rule. So is Abnormality is basically about having a bad appearance, or is it about committing unlawful acts, or is it about behaving in a certain way, or is it something else? So that is what we are going to actually learn today. We are going to focus on understanding abnormality and normality, how we can differentiate abnormality, and how we can actually spot out a person who has an abnormality. I think it's very important because in a society we see a lot of stigma. People don't want to share that they are abnormal. People don't want to share their mental health issues because mental health issues are always being looked in a very different way, right? So physical health issues are given much more importance, and people are very open and they are very happy to talk about mental health, physical health issues, whereas mental health issues are always suppressed and people don't like to talk about mental health issues. So that's why I decided that I want to talk about these issues openly, so that we can easily identify who is having a mental disorder. Because only when you're stressed, when you're depressed, when you're anxious, does it mean that you're having a mental health disorder? Or when you violate certain rules, or when you become abnormal, when you behave in an abnormal way, does it mean that you are abnormal? So that is what we are going to actually discuss in this particular session. So out of these four pictures, probably you might say it's the first one, second one, third one, fourth one. Now generally when I show this to my students, I mostly get the answers as the second one. They say the second person looks abnormal, but the fact is we can't decide based on their appearance. Probably mental health, mental disorders are always being stigmatized and always being misconceptual based on a person's appearance. So they think when the person behaves abnormally, when the person dresses abnormally, that they could have mental health issues. Now let's take example. Let's take Lady Gaga. So Lady Gaga is a very famous singer, and there was a time that people believe that she was having a mental health issue. But later on, it's not the fact. The fact is like she's passionate and she's fashionable. She loves her passion is fashionable. She loves to wear different clothes, attractive clothes. It doesn't mean that she has a mental disorder. So based on a person's appearance, definitely you can't say that the person has a mental disorder. Now let's say all of a sudden I just jump out into this chair and I start moving, I start dancing. Does it mean that I'm abnormal? Or when you're walking down the street, you see a person shouting at you, saying like, "Oh, you're a mad person. You're having a problem." So just because that person is shouting at you, can we say that he is mad? Or you see another person who is just sleeping on the street, middle of the street, and just because that his behavior is not normal, can we say that he is abnormal? So it's not how you perceive a person. Abnormality is something different. So that is where we're going to talk and pay much more attention in. We're going to identify what is normality, what is abnormality, and how we can actually differentiate mental disorders, and how we can focus on treatment planning. If I am too fast, you can ask me to reduce my speed. And also, if you have any questions, please put it in the chat box. Yeah. So, what is normality versus abnormality? Like, there was a time that people believe normality is kind of like you being normal, and abnormality is you have deviant behaviors. Yeah. For an example, let's say all of a sudden you feel like you want to remove your clothes and walk on the street. So people start thinking that, oh my God, this person has a deviant behavior. None of us will want to, go naked on the street, but this person wants to go naked on the street. It means that something wrong with this person. So probably people started thinking that, when people don't have consistent behaviors, one day I wake up early, the another day I wake up so late, another day maybe I spend the whole day on the bed. So when I have different behaviors, it means when I don't have constant behaviors, it means that I'm abnormal and not conforming to the social norms. Let's say all of a sudden I feel like violating a social norm, just going out of the laws. So it means that the person is abnormal. This is what we have been always thinking that abnormality is, but it's a big no. No, this is not abnormality. Abnormality is not deviating from what is normal. It's not about not being consistent, and it's not about not conforming to the society. So let's see what is abnormality and how we can spot out mental health disorders. Okay, so there are various definitions of mental health disorders and abnormalities. I'm not going to bore you by giving you all the definitions, but let's explore, let's explain a bit and see, what are these definitions of abnormality? So I'm not going to spend much time on statistical deviation, but I thought that that will also help you. Now let's say if you take a population of 100, if you take a population of 100, 95% will fall into the general category, average category. Let's say for an example, let's take IQ as an example. Okay, so if you take IQ as an example, if you take 100 people, 100 people population, and then out of that 100, definitely there'll be 95% who is falling under the middle category. So in this bell curve, this is called the bell curve. In the bell curve, you can see the peak. The middle is the average part where the 95% of the participants will fall into the average category. And definitely you're going to have 2 point variation to the left and 2 point variation to the right. So this is called the standard deviations. So standard deviation, they are deviant from the middle. So middle will be the average. Middle category will be the person who falls into the average category. And if somebody is deviating to the two extremes, then we can consider that there is a deviation. But this is not the only factor. This is just one out of 6 factors. So first you have to see whether the person is statistically deviating. But this can be done only when the behavior is quantified. Now, IQ can be quantified, right? So if you have above 75% of IQ, we call it as an average IQ. So we know that, if you're above 75, if you're above 70 to 75, then you have a good IQ. So majority will be falling onto the middle part, that's the average. And then you will have 2.5 deviation to the right and 2.5 deviation to the left. They will be that maybe extra, maybe higher IQ and maybe lower IQ. So if you could quantify the behavior, you can actually put it into the statistical deviation and see whether the person is falling under the majority or the average or the deviation. So based on that, you can decide whether there's a problem. But this is just the first criteria. So we have 5 more criteria. So the second criteria, social norm violation, breaking the rules. So breaking the rules cannot be considered as the only factor uh, for when you're considering mental health disorders. Breaking the rules, there should be some sort of a cultural expectations. For an example, let's say like in my culture, in my culture, certain crimes are not accepted at all. Okay, so probably due to certain cultural factors, probably people could fall into crimes. A financial crisis, yeah, financial crisis, or maybe poverty eradication. So there can be certain problems within the culture which makes a person to violate a norm. In such a situation, we can't consider that person as abnormal. Now, in my country, we are going through a really hard time. It's actually a financial crisis. Pray for my country. So we are going through financial crisis. So I see a lot of criminal behaviors. It has increased. Robbery, chain snatching, and then the what do you say, the abuses, and all of that has increased a lot. So it has increased because of the cultural and the country situation. So if it is something shaped by the culture, and if it's expected at this time, then probably it cannot be considered as abnormal. But you have certain expectations, you have certain rules in the society and in your culture, but still you are going beyond it, you're violating it, you're going beyond it, then probably you may consider to be abnormal. So most of our behavior is shaped by our culture, because the way I dress, the way I talk, the way I look, everything is shaped by our culture. And if I am going completely beyond that, probably yes. Now, a few days ago, I had a client, and she's actually having a mental disorder now. She's addicted. She's addicted to vapors. She's addicted to a phone, and she's addicted to porn. All of that. Now, in my culture, this is not acceptable, and this is not something that we can accept at all. So she's just by 15 years. She's been put out of the school, saying that you're having unlawful behaviors, and it's completely not acceptable, because a 15-year-old girl who is having unprotected sex with certain in relationships like with boys, and also she's addicted to phone, and also she is using certain substances. So this cannot be accepted. In that case, we can consider that as a social norm violation. So you have to see what are the cultural expectations, and if it is beyond it, okay, maybe the way they do it, the way they dress, where they eat, having eye contact, all that comes under the cultural factors. Now, in my country, somebody going nude on the road is not acceptable. at all, but there can be certain cultures where it is accepted, because in those cultures, it's accepted and it happens very commonly. But in my culture, if there's somebody who is going like that on road, definitely that person can be considered as abnormal. But just because that person is violating a norm, it doesn't mean that the person is abnormal. This is just the second criteria. So you just have to see whether the person is fulfilling all the five criteria. Just based on one criteria, you can't decide whether the person is abnormal or normal. So I remember there was a time that people used to do certain things for fun. They just try to go out without wearing dresses, maybe tops or something like that. So just go out just to make fun. Yeah. So in a such a situation, we can't say that they are violating social norms and they are abnormal. So you just have to see whether they are fulfilling all the criteria. So the second criteria is basically violating social norms. Then the third criteria will be maladaptive behaviors. So if somebody feels like I can't cope with my day-to-day demands, and I can't reach my goals, I can't focus, I can't concentrate, I can't look after myself, I can't take care of myself, I can't clean myself. If a person feels that the person can't adapt to the day-to-day life situations, and if the person feels like their inability to function well, so that's called maladaptive behaviors, then it's considered to be abnormal again. So maladaptive behaviors, sometimes they have disruptive relationships. They can't work in one place, they can't have a peaceful life. So I remember I had a client 2 days ago. She's very good, she's educated, and she's a lawyer, and she's from a very good family, but she can't maintain relationships. She finds very difficult to maintain relationship. Whatever the relationship that she gets in, she ends up in quarrels, and she ends up in fights, and finally she breaks the relationship. So she's been having like multiple relationships, she's been having nearly 10 relationships, but none of the relationships have worked for her. It's because a problem with her. Then later on, she found out that she's having a personality disorder. She's having a personality disorder. She's narcissistic. She's having narcissistic personality disorder. So because of that, she can't stick with one relationship. She finds very difficult to continue relationships. So maladaptive behavior. So they can't cope up with their day-to-day lives, day-to-day demands. So then it becomes very difficult for them to adapt with certain behaviors. So this is the third criteria where you have to look into. So if they're violating norms, and if they're having maladaptive behavior, yes, there can be something, but let's look at the other factors as well. Then personal distress. You know the difference between stress and distress, right? So stress is a normal level, and you can cope with it. We all have stress. Like probably if I'm having exams tomorrow, I will be stressed. If I'm having a deadline tomorrow, I'll be stressed. So you have use stress and chronic stress. Use stress is good to a certain extent. A dog is chasing me, and I'm like, oh dog, it's okay, I don't care. You chase me. If you're like that, definitely it means there's something wrong with you, because you need stress to a certain extent, because it's a survival instinct. But it doesn't mean that you need to have a chronic stress. A distress is a level where the person can't tolerate the level of stress. The person finds it very difficult to deal with this stress, and sometimes it becomes depression, anxiety, and it could even evoke certain other negative and extreme reactions and emotions. So distress is a clear sign of abnormality. If a person is feeling distress for a period of time, again it's for a period of time, then it's a clear sign that the person might have some problem. So this is also another criteria where you have to look into. Then deviate from the ideal. So you must be knowing, like, if you take personalities, if you take people, if you take expectations. We have certain expectations now. All of a sudden, if a person is shouting on the road, that is not ideal, right? A person can't just be shouting on the road, so it's not ideal. So it indicates there's something wrong. It indicates that there's a problem. Now, I told you narcissistic behavior. She always thinks that she's the best. She wants attention. She doesn't accept her mistakes. She's very bossy and she's very dominant. So she's not the ideal. So we don't like to see someone like that. The ideal is somebody who accept others, somebody who is very cooperative, somebody who understands others, somebody who can accept their own mistakes, criticisms, and develop themselves. So that is an ideal role. But here we see that it's not ideal. Something deviant. This is not the normal thing. right? So we can see there's something deviant in that particular person from ideal. It could be personality, it could be their mood, it could be the way they behave. So it indicates that there's something wrong. Okay, so does this mean that all the people who are deviant are abnormal? Can't be. Sometimes even I have been deviant. I still remember when I was studying in college. There were times that I used to be deviant. I used to dress in a very, different way, and I just had to. I just used to go out of the school, go out of the college, cutting the college for sometimes. So does it mean that I I was abnormal? I don't think so. Yeah. So just because that they are deviant from ideal, it doesn't mean that they are abnormal all the time. That is why this is considered as a category. It's not the only factor that we can look into. So it's just one category. Deviation from ideal is just one category. It's just another category. So I said violating social norms, maladaptive behavior and distress. And the next in the list would be deviating from ideal. So when a person is deviant from ideal, and you have to look into the other factors. If the person is fulfilling the criteria, probably we can say that yes, there can be some problem. Then finally, medical disorders. So that sometimes abnormality exists where there is a medical problem as well. Now, I had a client. She has been having a migraine for 15 years. Okay, she's been having migraine for 15 years, and she told me that she feels dizzy at times. Sometimes she feels like she's out of the balance. She's gonna fall, and also she feels like she can't control herself. Yeah, and she has aches. She has shoulder pain, body pain, hand pain, and different sort of pains. Then she came to me for counseling, and she has taken around 10 sessions. She has taken around 10 sessions of therapy, and after 10 sessions, she told me all her physical symptoms just disappeared. She gets it like very rarely, maybe once in a month when she gets upset for something, but other than that, she doesn't have any physical symptoms. So it clearly shows your physical health is aligned with mental health. When you have mental health issues, it's going to come up through your somatic symptoms. So you're going to show somatic symptoms in your body, whereas you're going to have pains, aches, and even it could lead to certain terminal illnesses as well. So medical disorders are also considered to be abnormality at times. And then let's take Alzheimer. When you take Alzheimer, they lose their, memory. You must be knowing what's Alzheimer. So during such a situation, we can consider that as an abnormality. Or a person goes to manic state and the person forgets completely herself, her identity, and becomes a different person, or maybe behaves in a different way, losing the insight. So in such a situation, we may have to, think that the person is having an issue, losing concentration, forgetfulness, having hallucinations, having delusions, and memory issues. All those things can be considered as a abnormality. I remember there was a client I saw before like 2 days. He was coming and telling that my phone is being snatched by someone, so I'm being hacked. I can see that people have put surveillance cameras across the room. Yeah, wherever I go, people try to follow me. Yeah, people are trying to take off my wealth. I can see that people are envying. So these are delusions. Delusions. So you can see that when a person has delusions, definitely there can be something wrong. And there was another client who I saw the same day. So she came and told me that I can see someone talking to me. I can hear that person is telling, you're so bad, you have to kill yourself, you can't live in this world. So all those are, hallucinations and delusions. So medical conditions, when a person has typical medical conditions, and when a person has typical symptoms like hallucination, delusions, memory deterioration, forgetfulness, attention, concentration issues, definitely there can be a problem. So that is also another criteria which we have to look into. So these are the five basic criteria that which we really need to look into when we try to when we try to distinguish a person between normal and abnormal. So the first and foremost thing is whether the person is deviating social norms, and then maladaptions, maladaptive behaviors, and then personal distress, and then deviation from ideal, and medical conditions. So I just want to ask you another question. It would be great if you can answer me, guys. I would be so happy. So are we all abnormal just because that we act deviant, or just because we express distress? Obviously, I must be expressing distress feelings in case if my husband leaves me, right? Or in case if I had to separate from my parents, obviously I'm going to feel distress. Yeah, or maybe if I face a death, or if I face a failure in my life, I'm going to be extremely distressed. So does it mean that I am abnormal? So if I display some sort of maladaptive behaviors, maybe I don't have a goal in my life. I'm just always sleeping on the bed. So does it mean that I'm abnormal? Yeah, or maybe I'm deviant from the normal. Maybe I have a very extroverted personality and I'm some sort of like a dominant personality. So does it mean that I'm deviant and I am not normal? So where do we draw the line between normal and abnormality? So what do you think, like, just because we have these three things, do you think that we are abnormal? Yes or no? What is it? Is it a yes or it's a no? Is it a yes or it's a no? What do you think? What do you think, guys? Is it a yes or it's a no? Alex, Rachel, Princess, John, Hannah. What do you guys think? January, what's your thought about it? No. So Princess says no. Yes. So it's a no. You're right. You're right, Princess. It's a no. So just because a person is deviant, or just because a person displays, maladaptive behavior, or just because a person experiences distress, a person can't be abnormal, obviously, no? Yes. So we must know where do we draw the line between normal and abnormal. That's very important. So that's where we're gonna, you know, we are gonna draw the line exactly. We are gonna draw the boundaries and see the difference between abnormal and normal. Yeah. So you have three criteria which you have to focus on when you are drawing the line between normal and abnormal. People are said to have disorders when they have behaviors becomes extremely deviant. Extremely deviant. Let's consider the normal is with this point. Yeah, the normal at this point, and if you're just 50 meters away from normal, probably you're not abnormal. Probably if you're 100 meters away from normal, and probably if you're 500 meters away from normal, and if you're 1 kilometer away from normal, yes, probably there's a chance. Yeah, so it's about how much you are deviant from normal. Are you extremely deviant from normal, or are you slightly deviant from normal, or are you like moderately deviant from normal? So you have to see how much a person is deviant from normal. And then maladaptive behaviors, how does this person copes with day-to-day life? So if the person feels like very bad at coping with day-to-day activities, if the person feels very difficult to function normally, or if the person is having extreme stress, distressing, and unable to cope with this stress, so probably at that point we may have to consider it as abnormality. So it's a matter of degree. It's a matter of degree. And for how long? So generally, what is the time period that we use to observe a person before we categorize them as abnormal? What is the time period? How long do you think that we need to you know what is the duration that we have to consider? What is the duration that we have to consider? How long? Yeah, so now generally, like now when I have seen I have seen over 7,000, 8,000 cases in my life. I have 13 years of experience in this field, so I've seen so many cases. So I see that there's something typical within all the cases. That is the duration of the symptoms. Like mostly it's between 3 months to 6 months time. So if it's for a very short time, let's say after a death you can be distressed, and you can have maladaptive behaviors, and sometimes you can be even deviant for 3 days, 1 week. That's fine. And if you are going on and on and on like that for about 6 months, then for about 1 month, then probably there's some issue. Same way, after a stressful situation, you can go through certain behaviors and it's normal. But if it's continuing and if it's happening for a long period, for more than 3 months, for more than 6 months, then it's a clear indication that there's something wrong. But after a stressful situation, after a trauma, there can be disturbances. There can be problems for a short while, but you will be able to get rid of it if it's not an abnormality, if it's not a mental disorder. So when you're distinguishing between abnormal and normal, and the mental when you identify mental disorders, it's very important to identify these criteria: whether the person is deviant, whether the person is trying to violate social norm, whether the person has maladaptive behaviors, maladaptive thought patterns, and poor coping mechanisms. Whether the person is unable to deal with day-to-day life, unable to cope with day-to-day life. All those things are very important. So according to DSM, if you look at the definition of abnormality, it says that when you have a behavioral, when you have a cognitive, and when you have an emotional dysfunction, which is unexpected in your cultural context and associated with personal distress and substantial impairment of functioning. So just because a person is a murderer, just because a person is a stolen, just because a person is a violent, has violent behaviors and does criminal acts, it doesn't mean that the person is deviant. So definitely, to identify what is deviance, you should have certain criteria. So that's like a person who has negative thought patterns, a person who has always been having maladaptive functions, yeah, and a person who has been going through distress for a chronic period of time, for a very long time, and a person who finds very difficult to cope with their day-to-day functions, then definitely we will be able to figure out that there's something wrong with that particular person. So we can't say just because a person is deviant that they are mentally sick, but mostly if you look at the people who have mental disorders, they are deviants. Yeah, because that they have deviant behaviors, because mental illness is not considered to be normal in the society. The reason why it's not considered to be normal in the society is basically because of the stigma. We have stigma in the society. We have lots of stigma towards mental health disorders, and people think that mental health disorders are extremely bad. It's because we believe that mental health is not important as much as physical health. So we generally believe that mental health is not good. Mental health is not important. If you have a mental health problem, it means that you're mad. You're not accepted in the society. So if a person behaves differently, if a person behaves differently in the society, still we consider that it is as a very a very bad thing and something that we need to stereotype and stigmatize. So I think that it's very important for us to debunk all these myths. So mental health is just a part of our health. So we have physical health, then we have mental health. There's no health without mental health. So mental health is also much important as physical health. So when I like my patients, mostly my patients, they come in the last minute to us. The reason why they come in the last minute, because they go to the scholars, they go to these all the magicians, and they go and they think that it's an evil possession. They think that there's something wrong with the person's physique. So that is why they are having all those issues. So later, the last time, after all the doors are being closed, after all the doors are being closed, they come to us seeking help. It becomes very difficult. So it's very important to spread the awareness and make people to understand what is a mental disorder and how can we identify mental disorders. It's very important to understand where do we draw the line, where do we draw the boundaries. Okay, so mental illnesses are relatively being considered as a very a very bad and a very wrong way, because the people don't have that awareness about mental disorders and what is a mental disorder. So as I said, so the cultural variations makes people to think that mental illnesses, mental disorders are basically just violating the cultural variations, but we are not ready to accept certain people as who they are, and as the way they are, because we have certain expectations. So when you have certain expectations over people, when you have certain expectations over certain behaviors, and when that behavior is not met, we generally think that the people are deviant and the people are having a problem. It is not like that. So I have given you the most important distinguishing criteria which will help you to spot out whether a person has a mental health disorder or not. So it's important to understand what is abnormal versus deviant behavior. because there can be a lot of deviant behavior in the society. People could display abnormal behaviors. People could even display attitudes as if that they are having a mental disorder. But just because we stigmatize them, just because we stereotype them, they're not ready to discuss about their problems with us. They're not ready to come out of the shell and expose their selves. Now, today, 365 million people across the world are having mental health disorders. Every year, it's raising. Out of that, more than 60% is not getting help. The reason why they're not getting help because they're always being stigmatized, they're always being stereotypes saying that just because you are having a deviant behavior, it doesn't mean that you need help and you are not suitable for the community, you're not suitable in the group. You're just someone, you're just normal, you're just not normal, and you're someone that away from us, away from the community, so we can't take you. So it's very important to give this understanding that people could have deviant behavior, but just because they have deviant behaviors, it doesn't mean that they're normal. They're not. They are abnormal. They can be normal, but when a person shows deviant behavior, you have to give them a hand. You have to give them a support where they could actually express themselves clearly, where they can give you, where they can gain some sort of confidence and some sort of a strongness where they think that okay, I have somebody to express myself. But whereas we see in the society that people are not ready to help such people, whereas people are trying to corner them, people are trying to stigmatize them so that they don't get that proper help. Now, in my career, in my profession, I have cured many patients who are having mental health disorders, mostly anxiety, depression. In my community, the highest is depression and anxiety. Yeah, we have a lot of anxiety patients and depression. Anxiety is higher, depression is quite high, and then we also have personality disorders like borderline personality disorder. Yeah, that is quite high. The narcissism is also quite high. Then also, I could see there's a lot of stress disorders like PTSD, ASD, ASR, and then also we have substance abuses are becoming very high because of the uh, financial crisis. People are getting addicted because they're out of their mind. So these are the common issues that we get to see. Sometimes we have a lot of addictions like porn addictions, sex addiction, and then even we have a higher rates of divorces. It's up to like 80% now. So there's it's like higher rates of divorce, and the divorce rate is extremely high in the recent past. So that's also because of different problems like intimacy issues, sexual issues, and then financial issues, mental health issues. So these are some of the common problems that we get to see in the society. But I'm glad to say that if they are coming forward and if they are consistently taking therapy, I have cured more than 60-70% of my clients, because when they are committed and when they're openly coming, I am able to give them the hand. I'm able to give them the support to take them out of their mental condition. So all they need is a supportive environment first. So in the upcoming sessions, we will be looking into the other factors as treatment planning and what are the disorders. So please join my other sessions as well. Support me. I'm sure that you're going to learn a lot out of these sessions. So the most important thing that I want to mention, therapy or counseling therapy, all this can be done only like 20 to 30%. The most important thing that they get out of the community is support, a lot of support, sometimes 50%, more than 50%. Your support can heal a person. Having a non-judgmental attitude, having an open posture, and listening to them without judging them, and accepting them for who they are, unconditionally accepting them, and giving them empathy, and also creating a very confidential environment, because in the society we have seen a lot of people who fall into problems because they don't have anyone to share their problems. They have been bottling up, they have been suppressing their emotions, so they don't have actually anyone to express themselves. So that leads to a lot of problems. So create a supportive environment where they could actually express themselves clearly and give their ideas, give their thoughts, make make them feel that they are accepted, make them feel that they are very much they're very much accepted and given that warmth, and also make them feel that they can share anything with you, so they will be opening up to you. So let's imagine now, let's say this bottle, let me take this bottle to my hand. Okay, so if I am keep on pouring water into this, and at one point this is going to get blasted, because it's quantifying too much than what it's supposed to be. So when it carries too much than what it's supposed to be, definitely there's going to be a point where it's going to get bursted. So mental health is also the same. The more you suppress your emotions, the more you suppress your thoughts, there will be one point where it's going to get blasted, because it's been suppressed too much. So you need somebody to express your feelings, somebody how you can trust, somebody who you can give you that unconditional positive regard without judging. So I think it's very important to give that support, so that you will be able to get out of that person from this particular mental condition. So there are certain conditions where they need medical help, like bipolar, schizophrenia, and certain extreme levels of depression, extreme levels of anxiety. So there can be so many situations where they need medical help, but there are certain situations where they don't need medical help, and they can overcome and cure themselves through therapy. So it's very important to give that understanding, that through therapy you can actually get rid of your problems. There are situations where they need medicine, and you have to direct those patients to a psychiatrist. But if not, being a psychologist, being a counselor, you can help that client to overcome their overwhelming thoughts, overcome their overwhelming emotions, by giving them that support. Yeah. So, yeah, if you have anything to say, probably you can comment in the chat box. So, thank you so much. I am getting some comments. Thank you, Dennis. I would like to read it, but unfortunately, I'm running out of my time. So, probably after the seminar, I would like to, read it. Thank you very much for all the information and all the feedbacks and comments that you have been sharing. So basically, we will be looking into the different mental disorders, and what sort of therapy, what sort of treatment that these mental disorders needs, and also we can go a little bit in depth and understand the symptoms, causes, and then the etiology, the causes, and also the triggers, and what are the biological, psychosocial, and cultural factors which leads to mental disorders. So I am very much proud and happy in this career and in this profession, because I have given hand to many, many, many people, and people keep sending me a lot of messages saying that I have changed their lives. So I think that is the best thing a human can achieve in this world, is changing another person's life. Definitely, I think nothing could compensate it. So through understanding a person's mentality, we can definitely help them and create the awareness that what are they going through, and what needs to be then done, and how they can overcome these problems. So basically, so today's session, I just want to put everything in a nutshell. So today's session is basically about how can we identify whether a person is having a mental disorder. So what is the difference between normality and abnormality? And just because a person is deviant from the normality, and just because a person is having distress, just because a person is having maladaptive coping mechanism, it doesn't mean that person is sick or mentally disordered. But you have certain criteria, you have certain definitions, where you have to be focusing on these factors in order to identify whether a person is having a mental disorder or not. So there can be people who are internally suffering, but they can't express this out because they don't have that proper platform to just vent out their emotions. So it's very important to give them that awareness. This is whether it's a mental disorder or not. How can you distinguish a mental disorder, and how can you identify that it's a mental disorder? So there are three criteria. It can be deviant, it can be maladaptive, it can be distressing, it can be social norm violating, but for a period of time. For a period of time, they have to be, they have to be deviating from that particular period of time. where we can actually see whether they are having a course of illness for a duration. So we call it as course of illness. So for a duration, so that we know that that person might be going through something. So in that case, in a such a situation, definitely you need to direct that person to a professional. So there's a huge difference between psychologists and psychiatrists. So psychiatrist is basically one who provides medications. The person who provides medication with an MBBS degree is called, a psychiatrist. In my society also, it has happened a lot. I see a lot of psychologists are prescribing medicine. It's illegal. It's not acceptable at all. So it's not acceptable at all to prescribe medicine being a psychologist. You can't prescribe medicines. You can't prescribe ECT unless you have an MBBS, unless you are a doctor. So if you are a psychiatric doctor, you can prescribe medicine. So make sure if you are going to a psychologist or a psychiatrist, and if the person, if you're going to a psychologist and if the person is giving medicine, it means that they are committing something unlawful, which is not acceptable. Only psychiatrists can give medicines. But there can be situations where people need medicines, but there can be situations where people doesn't need medicine and they can be cured through therapy. So therapy is very, very important. What is therapy? So therapy is a way of talking. It's not only talk therapy. It involves a lot of activities, exercises, therapeutic alliance where the person gets help to deal with their symptoms, deal with their maladaptive thought patterns and maladaptive behaviors, and it helps them to come out of their distress and to have a balanced and a healthy life. Sometimes there cannot be an execution from the disorder. Certain disorders cannot be cured, but still they will have a better, adaptive, acceptable way of living with the disorder. So therapy is very much important, guys. If you're going through some mental health issue, please talk to your therapist before it gets late. As I told you, once it get late, once all the doors are closed, probably you will not be able to get a solution at that point. So once you recognize, once you feel that there is something and you need treatment immediately, please consult a professional and get yourself checked. So, if you go to a psychologist, probably the psychologist will have some screenings, psychometrics, some testings to check whether you are having a problem. Now, if you go to a psychiatrist, so based on the symptoms, the psychiatrist will come to a decision whether you are having a problem or not. But you have to decide whom you should go first. If your symptoms are minute, if you think that you can recover yourself from therapy, please go to a therapist. Or if your symptoms are very severe and if you feel like you need medicine and you can't get out of this only with therapy, then probably you need to go to a psychiatrist. So there are various mental health disorders that we are going to focus on, focus in the upcoming sessions. So we have planned for 10 sessions. So each session is going to talk about a mental disorder, and also it's going to talk about the yes, treatment planning, and also it's going to highlight the causes, the factors, the triggers, the different possibilities and all of that, and treatment planning as well. So I want you to stay tuned with me for all the sessions. So I think this would have given you some sort of a very good understanding, because now when you diagnose a person, it's very important to think of the consequences, because sometimes when you diagnose a person properly, nowadays we see this a lot in the society. When you diagnose someone, they go home, they Google, and they put the diagnosis in Google and they find all the unnecessary information, all the unnecessary symptoms, and they start thinking that they are having those symptoms. So this is called secondary symptoms. Secondary symptoms are not primary symptoms. Like they don't have those symptoms actually, but just because they Googled, just because they found out that they are having this condition, they start imagining that they are having these symptoms. So before you diagnose, make sure that the person it doesn't affect the person. There's no consequences. There's very less consequences. because when you diagnose a person, probably it could lead to a labeling. So person could start thinking, oh my god, I'm depressed, so I'm a depressed patient, or maybe I'm having bipolar, so I'm a bipolar patient. So they can feel very low about it, so they can feel very low about the diagnosis. So in that case it's going to affect them much more. It's going to create more problem, it's going to create more distress in them. So it's very important to check whether the person needs a diagnosis, or you can have your diagnosis with you, give them psychoeducation and insight and awareness, and take them through the treatment planning, because this medicalization also has good things and bad things as well. So sometimes the stigma is a bad thing, and the treatment that they provide, these things could create some risk factors. But if you look at the positive side of diagnosing medicalization, is it's easy to spot out the problem. Yeah, it's easy to spot out, and you can deal with it when it's very mild itself. Yeah, and you have medical opportunities where you can quickly take off the client out of the problem. So there are certain conditions where you need a mild dose and you can quickly come out of those mental disorders. So you have positives and negatives as well. Then, so we were talking about the differences between psychiatry and psychology. Yeah, you can see this. This is also something important. Now, each and every behavior has a possible diagnosis. If you take shyness, in diagnosis, we could say social anxiety disorder. If you take naughtiness, we can say conduct disorder. And if you see active, we can say hyperactive disorder. Then, if you see someone worried, we can say generalized anxiety disorder. So, when you say somebody is unsuccessful at gambling, so we say it's pathological gambling. And when someone is stressed, we say it's acute stress disorder or some stress disorder. So when someone is smoking, we say it's an addiction. So likewise, for each and every behavior, there's a diagnosis. There's a matching potential diagnosis. But you have to make sure, you have to really think whether you need the diagnosis, or it's just something that you can deal with, proper therapy and proper treatment planning. So it's very important how you can incorporate this understanding of mental disorders with your practice. Certain things you cannot be directly aligned with that. There can be situations where it will be really helpful. I remember I had a client. That client was telling me, "Ma'am, please don't give me a diagnosis, because if you give me a diagnosis, I'm just going to think that I am that, and I'm going to waste my entire life thinking that I have a severe mental disorder." So the first thing she told me was, "Please don't give me a diagnosis. You tell me what I need to do, I will do. I will do anything to get rid of this problem." This is one incident. And there was another client who came to me and she told me, until a doctor told me that I'm having autism, I thought there's something wrong with me. But I thought that, okay, it can be, it can be cured, and I can actually take myself out of this. But the moment I got to know that I'm having autism, that's when I started feeling so low, and I decided that I can't ever come out of this. So there are times that diagnosis becomes a real problem. So when you diagnose a person, make sure that whether it's important, whether it's going to create a positive or a negative impact. And there's a positive side of diagnosis also. So mostly it's positive with the clinician, because it helps me to do the treatment planning properly and help the client, and it gives me a lot of understanding about the client. But it might not help the client, because the client doesn't want to have a such a diagnosis in their life. So when before you diagnose, definitely you have to make sure whether the client needs the diagnosis or not. So certain disorders like major depressive disorder, certain disorders needs a diagnosis, because we need to do the treatment planning properly, and we need to come up with the action plan, like how we are going to take forward the client, how we are going to prevent the relapses. So all that is very important. So finally we're going to talk a little bit about why do we need to study about mental disorders, and why do we need to study about this abnormal psychology particularly. Because in mental health, this abnormal psychology is one area which is being some sort of taboo. People are not very open to talk about abnormal issues because they think that it's something extreme. Yeah. But we know that it's something that we experience in day-to-day life. Even I have been going through a lot of stress in my life. So there are times that I have gone through stress. When I was pregnant, I've gone through a lot of stress because I had physical problems. Then I had another kid to look after. Then I was mentally down because I was having a baby blues. So then all those things were there. So it means that there were times that we also feel distress. We also feel like some sort of a negativity. So it's not the same all the time. So there are times that I have felt like life is unfair at times. At times, not all the time. If I am feeling that all the time, I can't be a psychologist, obviously. So yeah, at times. At times I have felt like that. Yeah, but quickly I'll be able to overcome that. Yeah. So the importance of studying mental health disorders is first to gain an understanding about what are you going through, because you can also have common experiences in your life. Okay, and there's a lot of unanswered questions. Why is it happening? Why is it happening with me? What is triggering it? What are the causes of it? Okay, from where is it coming? How long it's going to be like that? Yeah, what is going to help me? What will not help? How can I overcome this? So these questions, you need answers to these questions. So definitely studying about mental health disorders and abnormal psychology is going to help you to get an answer for all these questions. And also, like preparation. Now there are leading causes for mental health disorders. One of the leading causes for mental health disorders is severe stress, prolonged stress. So prolonged stress is one of the leading causes. Then you have negative thoughts, yeah, emotional dysregulation. So there are certain causes, there are certain factors which leads to mental health issues. So if you want to prepare yourself, if you want to take yourself off of mental health disorders, definitely you have to prepare yourself beforehand. You have to identify what are the factors which affects you and which affects your mental health, so that you will be away from mental health disorders. And it's very important to understand from where is it coming. It can be a biological factor, it can be a psychological factor, it can be a personality issue, and also it can be a psychosocial issue, and also it can be a cultural issue. Yeah, so there are different factors which is causing mental health disorder. Any person on earth is prone to mental health disorder. Why am I saying like that? The reason why I'm saying like that, because anyone could catch a mental health disorder. It's not you, it's not only me. Anybody could catch a mental health disorder because we all undergo stress. We all have negative thoughts and we all have had our bad past. So trauma is one of the leading causes of mental health disorders. So when you go through abuses, when you go through separations, death, and then when you go through prenatal postnatal issues, yeah, and when you have had some sort of a breakup or some sort of a bully, yeah, or maybe negligence, emotional, physical, sexual abuses in life. So all these traumatic incidents also could lead to mental health disorders. So we all go through these things in general, right? So these are very common things. Like if I ask of you, like, is there anyone without problems? You would say no. Is there anyone without problems? Here, is there anyone in this meeting without problems? Is there anyone? Is there anyone here without problems? I'd be so glad to know. Is there anyone without problems? What do you say? I guess no one. Sunday. Hi, Sunday. I don't know whether I'm pronouncing your name correctly. Yeah, no one, right? We all have problems. So we all are prone to mental health issues. So we are vulnerable. Certain people are vulnerable to mental health issues because certain people have personality issues. There are neurotic personalities, there are sensitive personalities, introverted personalities. Yeah. So there are certain people who are vulnerable to mental health issues. So we all go through these difficult times in our life. So when you go through these difficult times in your life, it means there is a chance that you also get into a mental health issue. But how can we protect ourselves? That's where the abnormal psychology, and that's where the awareness of abnormal psychology comes in. When you have an understanding about what factors leads to, what factors leads to cancer, what factors causes cancer, you can cut off the trigger and you can avoid the cancer in your life. Same way, when you are aware what factors leads to mental health issues, how can you cope with day-to-day stress? Definitely, I think you will be able to overcome your mental health issue as well, because we all are going to face all these factors in our lifetime. So it's all about not avoiding, it's about resilience. Even after facing something, how can we get back to our normal? So resilience is becoming very popular. It comes under positive psychology. So resilience is something that we can consider. Yes, we are going to have problems. Yes, we are going to face hardships. Yes, we are going to, have a hard time in our life. But still, how can we use resilience to overcome the problems? How can we use better coping mechanism, better coping activities, so that we will not be prone to a mental health disorder? So to get that understanding, definitely you need to have a very good understanding about abnormal psychology and mental health disorders. Also, knowing about mental health disorders helps us to get a better understanding about this disorders. As I said, in depression we have different types of depression. You have unipolar, you have bipolar, then you have dysthymia, you have major depression, you have cyclothymia. So you have different types of disorders, you have different types of depression. And if you take anxiety, even again, anxiety has different criteria. Criteria. You have generalized anxiety, then you have phobia, you have specific phobias, and then you have OCD, then you have panic disorder. So there are different kinds. So even stress disorder is the same. You have acute stress disorder, chronic stress disorder, PTSD. So each disorder has an in-depth understanding and in-depth criteria, and also the causes. Why mental health disorders are occurring. Why is it occurring only with certain people? So to get an understanding about the causes of the mental disorder, it's very important to get an awareness about abnormal psychology, and also the classifications like DSM classifications, the criteria, the symptoms. Now, if you take corona, you have certain symptoms for corona, right? So only if you know the symptoms of corona, you will be able to identify and spot out the exact problem. Unless you know the symptoms of corona, unless you know it's corona, you can't find it out whether it's corona or not. Same way, every disorder has their own symptoms, and it has their own duration and the cause of illness and the onset of illness. So if you want to understand mental disorders in depth, you need to understand all these factors. It's just not like one thing, it's a multiple factors together. Yeah. So if you want to understand mental disorders, you also need to understand about what is onset, what is cause, what is duration, what is etiology. Yeah. What are the factors which pertains to mental health disorders? So all this is a contribution to mental health disorders. So for an, as I said, example, corona, you have to do a screening, you have to go through a test, and you have to see whether you have corona or not. Same way, if you have depression, you go to the psychiatrist or you go to the psychologist and you talk about your symptoms, then the psychologist will give you a test. You have psychological testing. It's called psychometrics. So you have psychological testings where you have to go through certain testings, where you have to, come out with an outcome. Based on that, your psychologist or your psychiatrist will tell you the severity, whether you have that condition or not. Yeah. So to get a proper explanation, definitely you need to understand about mental disorders and classification. Then, nevertheless, treatment planning. Treatment planning is also very important when it comes to mental health disorders, because it's not like physical issues. Physical issues can be cured very easily, I would say, but mental health issues are not can be it cannot be cured very quickly. Probably Nasir would agree with what I say. You know why? Because each person is different. Now, my anatomy is the same as yours. We both have the same anatomy. There's not much of a difference between yours and mine anatomies. But if you take my mental makeup and your mental makeup, it's entirely different. If there are 50 people, we can't apply one approach to all the 50 people. You need to have 50 approaches. That is why it's very difficult to cure mental health disorders, whereas physical health issues, you have discrete treatments, you have proper treatments. If you apply those treatment to a person, you can get that person out of the condition. But mental health conditions are not like that. Sometimes, even if you have so many chances, and even if you do a lot of treatment, there can be times where the person is not cured. In my career, I have seen there are hundreds of schizophrenic patients where there is no cure, there's only improvement. So you can improve the patient. You can see some sort of a betterment, progress, but there's no cure. Same way, sometimes even in bipolar, yeah, sometimes there is cure, but they have relapses. If you take OCD, there is cure. You can cure an OCD patient, but you will have relapses. So, dissolving or dealing with a mental health disorder is not easy at all. It's not like a physical health issue because physical health issue it's same anatomy, same theory applies to all the humans because it's the same mechanism. But individuals are highly different and they are unique. Their individual differences exist. So in that case, you won't be able to apply one theory to all. So it's very important to have an in-depth understanding. That is why psychology is becoming very popular because you need to have an in-depth understanding about human beings. Dealing with human beings are the most difficult thing in the world. I hope you'll agree with me. Yeah, understanding humans is the most difficult thing in the world because just imagine whether you able to understand your own self. Are you able to understand your own self? Not really. So if you can't understand your own self, how can you understand others? It's very challenging. It's not easy at all. So make sure that you develop your knowledge. You get a very broad understanding. You get a very in-depth knowledge and understanding about these issues and mental disorders, so that you will be able to do the right thing. Most of the psychologists, most of the psychiatrists fails. They are unable to treat their patients. The cure is very less when it comes to mental health disorders. The reason is the broad knowledge, the broad understanding about the condition is not there. It's very minimal. There's only very few professionals who actually succeed in their profession. It's because they don't have that in-depth knowledge and awareness about the problem. Yeah, so understanding about mental disorders is very, very, very crucial and important. Just getting some knowledge is not going to help you. You need to have an in-depth knowledge in order to deal with the mental condition, and that is also being backed up by so many other factors. If you look at the stream of psychology, there's a hundred of streams, substreams. There's hundred of variations. You need to focus and study each and every stream to get a better understanding of psychology and mental disorders. So mental disorders, just because you study abnormal psychology, just because you study only the mental disorders, probably you will not be able to treat a client, treat a patient. Definitely, you need to have a in-depth knowledge about psychology. Psychology is like a sea where you have to, where you have to swim, go in that, sometimes even may get drowned. You have to find your knowledge within the field. So only then you will be able to get a very broad perspective about mental disorders and able to deal with the client. So the reason why I want to talk about this because I thought the field of psychology, in the field of psychology, the mental health disorders are very crucial and important to understand because a lot of people are suffering out of mental health disorders. So if you at least can spot out and can help them to think that they need help, they need treatment. Probably that will save a lot of lives. So recently, also in my community, there was a death of a 15-year-old child who has committed suicide, who has jumped from the school bridge. So just a 15-year-old child, she has jumped over the bridge in the school. So later they have found out that she's been suffering with depression for a long time, but the parents weren't aware of that. So parents have noticed some differences, but they have thought that maybe she's having an affair, or maybe she's into some other addictions or something. That's the reason why she was feeling in this way. So later on, they found out that through a few of her friends that she has been telling that I'm fed up of my life. I don't want to live this life. I just hate this life. I can't take this life anymore. So it's very difficult for me to bear. So she has been mentioning all these things to her friends. But at home, the parents were really thinking that maybe she was into some relationship or she was into some stress. That's the reason that she was feeling little, she was just, behaving little different. But after she committed the suicide, they got to know that, it was because that she has been feeling depressed. So there were few cases reported recently because, you must be knowing when the crisis arises, like all the problems triggers of by crisis. So even we need a lot of help because we are in the crisis. So our mental health are, taking a toll on us. Definitely, this crisis is creating a lot of problems. So these things are happening. So we are trying to, spot out the problems. We are trying to help people to understand what they're going through, and we are trying to give them a patient, non-judgmental hearing, so that they will, open up to us and give us a very good support and get support from us in dealing with mental health issues. So if there's any like questions related to what I have been talking all this while, you can just put it in the chat box. If not, maybe towards the end, I can clarify the questions. So, so let's look at quickly what are the terms that is being used in mental disorders, like environmental stress, hereditary medication, damage to brain. So all these are like common terms that have been using in mental disorders, like because mental disorders can be hereditary. It can transfer from your ancestors. It could be inherited, could be in your gene. So mental health disorders are inherited, and mental health disorders can be triggered due to addictions. Yeah, and mental health disorders can be triggered by environmental stress. As I said, now we are going through crisis. So crisis is making people to go mad. Basically, people are going out of their senses because they can't take off this pressure, and sometimes damage to brain, like having head injuries, traumas, accidents, certain surgeries. Yeah, so all those things could also lead to mental health disorders. So we have a lot of testings. We use testings to diagnose. So we have IQ test, and then we have personality testings, and then we have projective testings. Then we have uh, aptitude test, and we have test disorders, test related to disorders, particular disorder to identify whether that person has a disorder. So all these things are like very crucial in the field of psychology because it helps us to get an in-depth understanding about the disorder. Now, when you look at me outer, probably you will not feel like I'm having a problem. Actually, I don't. But when you look at a patient, probably you will not see any problem when you look at the outer, when you see only the appearance. But when you go in depth, when you try to analyze the person in depth, when you try to go in depth and do a proper testing, probably at that time you will be able to spot out that there's something wrong. Even the personality testing helps us a lot. Personality testing helps us to see whether the person has any weaknesses, whether the person has any blind spots, whether the person is having a problem with their personality. So that gives us a very good understanding about what's happening internally, so that the person could able to get an in-depth analysis. Like now, let's say I'm angry. My anger can be caused by so many factors. Probably because that I'm neglected, maybe I'm lonely, maybe I'm hopeless, maybe I'm guilty, maybe I'm stressed, or maybe I'm hungry. Even my hunger could lead to anger, right? So there can be so many factors which is causing my anger. Yeah, but this cannot be seen outer. Only my anger can be seen. Maybe my hot flushes. Maybe I have turned red and I'm using some behaviors. Only that is visible from outside. But what is inside is not visible. So that's where we use the test to diagnose what's going inside the person. Okay, so even personality tests helps us to understand whether I'm an introvert, extrovert, ambivalent, or maybe I'm a neurotic person. So there are certain personalities are prone to mental health disorders. Yeah, so in that case, probably that is also a way of analyzing a person. So you use tests to diagnose the person. Then also, if you look at the treatments, yeah. So finally, we can discuss a little bit about the treatments. So what are the treatments available? Now, if you look at psychiatric treatments, obviously it's going to be medicine, yeah. But other than psychiatric treatment, there are so many other treatments which is available. You must have heard about hypnosis. Hypnosis is you will be put to an altered state of consciousness, and we try to go in depth of your mind. We try to go into your unconscious mind and try to identify certain factors which would have affected from your past. So hypnosis is a state of semi-consciousness in which a person actually reveals certain hidden factors. Yeah. Then we have psychoanalysis. Psychoanalysis is we try to understand the unconscious drives, unconscious desires, which is making us to suffer. So psychoanalysis is a very good therapy method, and also we use a lot of play therapy with kids. But we use expressive therapies with adults. So play therapy is basically for kids. Yeah, so we give toys, we give we use art therapy, we make them to draw, and we try to understand what is in their internal unconscious mind, and also we help them to express their emotion through play and therapy. And then we use expressive therapies like art therapy, drama therapy, sound therapy. All those therapies are very effective. And then we have biofeedback. We try to measure certain things through physical responses to emotional issues. We just try to understand whether the person is going through certain things physically. So that's also something very useful. And then we have behavior therapy. So behavior therapy is where we try to change a person's behavior. So generally we believe that all behaviors are learned. So we try to change a person's distractive patterns of behavior which is being influenced by their environment, because behavior therapists believe that environment factors affect a person's behavior. So behavior therapy is also becomes very important. Yeah, so involves then also we have a group therapy, a supportive a group therapy. You must have heard about Alcohol Anonymous. Those are like supportive group therapies where we try to get people who have similar issues. We get them to talk about it. We get them to talk about it, and we get them to talk about how they have dealt with it, how they have coped with it, and how they have been dealing with it. So the other person could learn from them. And then also we have electroconversion therapy where we been inserting certain electrodes on a person's head, and then we give them a very mild electrode and just try to stimulate their brain. So through that, we try to cure certain mental condition. That's also effective. That's also one of the most effective conditions. So effective treatment methods. So we have ECT, and then we have group therapy, and also we have therapies like CBT, where we try to change a person's thought process, how the person thinks. So that we do through CBT, and then we have MBCT, where we try to bring the person's awareness into the present moment and make the person to feel mindful and just to get out of all their thoughts. And then we have exposure therapy. Then we have also DBT, dialectic behavior therapy. It is very effective for personality disorders. And then also we have Gestalt, person-centered, humanistic, and existential. So there are a lot of therapies which we use to help the client. So I think these therapies will definitely help the client to get out of their problem by understanding better. And also we give psychoeducation to the family, because most of the time the family members doesn't know what's happening with the client now. Yesterday I had a session, a psychoeducation session, where the husband, wife, sorry, The husband is having OCD, where the mother, father, and the wife, they aren't aware anything about OCD. They don't know A2 is a head or tail about OCD, right? So they're asking like, what is OCD? Yeah, why can't he control it by himself? He can just distract his mind. He doesn't have to think about all those things. But they're not ready to understand what the person is going through. If the person could deal with their problem by themselves, then why do they have to come for therapy? Why do they have to seek help? Why it is considered to be a disorder? I have fever, and if I say that, yeah, I can heal my fever, I don't want any support. It's very nonsense. It can't be like that. But mostly mental health issues, people ask, why can't they deal with their issues? Why can't they be, why can't they be treating their issues by themselves? Why can't they be just ignore it? Why can't just they can't get out of their thoughts? Like we are also dealing with our thoughts better, but they don't understand it's a disorder, it's a disease. It's a disorder where the person can't control themselves. The person doesn't have the control. So definitely you can't expect a psychiatric patient to deal with themselves by their own. So OCD is a typical problem. It's a typical anxiety disorder where the person has obsessions and compulsions. Yeah. So you need to understand. So we give psychoeducation to the family. We mention that this is what the patient, this is what the client is going through. So you need to give them support. You need to give them understanding. You need to give them that hearing. Only then you will be able to, you know, get the patient out of that condition. So that's called psychoeducation. Then pharmacological treatment. So we have drugs. So when you have anxiety, we have anti-anxiety agents, relieving anxiety tablets and medications. And then we have antipsychotic agents. That's for relieving agitation. And then also uh, we have antidepressants. We have uh, yeah, I'm just moving on to the last slide where I have mentioned about the uh, sorry, sorry for the interruption. So we have this antidepressants where we deal with depressive symptoms. So all these pharmacological treatments, all these medicines helps us to overcome as the symptoms. So pharmacological treatment is also important, but still therapy and pharmacological treatment together would work much more better. Sometimes medicine alone will not work because medicine could relieve the symptoms, but medicine could not dig into the cause, root cause, and cure the cause. So in order to cure the cause, you need therapy. Let's say, for example, the reason why I got depression is maybe because I had a trauma in my life. So medicine can help me to get over my symptoms. Yeah, it can help me to overcome my depressive symptoms, but it can't help to get over my past. So I need some sort of a help to get over from my past trauma. So that's where I think I need therapy. Yeah. So probably like let's say I'm having stress and I'm having certain symptoms because of stress. So my symptoms can be dealt with uh, pharmacological treatment. But now there's a problem in depth. That's the stressors. Whatever happening in the environment, I'm unable to cope. I don't have good coping skills. So that I need to deal with therapy alone. I can't be dealing with medicines. Medicines cannot help me. So in that case, you need to combine medicine and therapy together. So I hope whatever that we have been discussing so far is clear. If you have any questions, you can ask me. So we have this worldwide two diagnostic systems to understand mental disorders. So largely, we've been using DSM. So DSM is the Diagnostic and Statistic Manual published by American Psychiatric Association. So Psychiatric Association is the worldwide body which is responsible for forming criteria and forming manuals with regard to mental disorders. Then also we have International Classification of Disease (ICD), which has been published by World Health Organization, which is also being used as a manual to diagnose mental health disorders. These are the two basic manuals that we use to diagnose mental health disorders. So that is one is DSM and the other one is ICD. So the revised versions are DSM-5 and ICD-10. This DSM has a history, so I'm not going to bore you, but I just want to mention this DSM is a multi-axis model. So in this multi-axis model, we have five axes, where the first axis is known as the clinical disorder, another condition that focuses on cognitive impairments, which includes all the mental disorders except personality disorders and mental retardation, because all the other disorders are being categorized in the axis 1 according to SFTR4. So axis 1, the clinical disorders and the other conditions. And then axis 2, you have personality disorders and you have mental retardation. And axis 3, you have medical conditions. And axis 4, you have psychological and environmental problems. And finally, you axis 5, you have the levels of functioning. So the advantages of having a multi-axis system, because it helps us to communicate and evaluate among the worldwide clinicians, because we all have a common system. So when you have a common system, there's very less chances that we go beyond the system. So that's one thing which helps us to understand the mental disorder from a very common perspective. Then also it gives us some sort of standardization. It helps us in detailed manner. It gives us the criteria, the symptoms, the etiology, the treatment planning, everything in details. It becomes some sort of like a standardization of symptoms. Then also we have this, general medical conditions and environmental factors, and how these stress factors affects mental health disorders, and which leads to mental health disorders. So in that case, it also gives us a very good perspective about how these mental health disorders are uh, are triggered by environmental factors, also possible physiological issues and medical conditions, general medical conditions. So all these factors are being connected to one another. So just give you a very brief about the manuals. It's just a very brief about the manuals. So we have this classification system called ICD. So in DSM you have the access. ICD, it was developed by World Health Organization. It is also a system. This is mostly used in Asian countries as well, and it can be used worldwide. And it was published in 1977. It has a very good way of identifying mental health disorders, and it has some sort of a criteria where you can have a very good understanding about each and every category separately and each and every disorder. So I think with this we are done with the introduction. So I think I have given a very clear picture about what are mental disorders, and why it's important to understand mental disorders, and how can we distinguish between normal and abnormal behaviors, and how can we define abnormality, and how can we define mental health disorders, and what are the criteria. Then we also discuss about that all deviants are not abnormal, but mostly abnormal people are deviant. But still, you have certain categories, you have certain duration, you have certain levels to draw the boundary. And also, we were talking about medicalization, and what is medicalization, and what is about diagnosing, why it's important to diagnose. So, and then we were talking about the treatment methods, and how can you support a person generally, and why do we need this awareness, and finally the statistical manuals, and how all these factors could contribute in the field of mental disorders. So if you have any questions, you can just put in the chat box. If not, we can just uh, wind up the session. Any questions? Any questions related to what I have been discussing all this time? Any questions related to my presentation?
Thank you so much, ma'am, for your rich content presentation, which can impact our knowledge seeker surely. After your presentation, I hope our knowledge seeker can learn something new, which was our only intention. Learn and grow together, IGP knowledge seeker. Once again, thank you so much, dear ma'am, for your presentation. Now, ma'am, it's time for our question answer session, which is the one more valuable part of our regular webinar. Honorable ma'am, please stay with us. After a short video, we will start our question answer session. Dear IGP knowledge seeker, please ask your question in the comment box as much as you want to know from our speaker. Thank you. After question answer, we have webinar certification and online quiz competition. Dear IGP knowledge seeker, please ask your question in the comment box as much as you want to know from our speaker. Thank you. After question answer, we have a webinar certification and online quiz competition. Welcome back, ma'am. Welcome back to our participants.
Hi, Sunday. I have also been dealing with certain school kids who are having mental health issues. Sunday, I think the most important thing that you need to do with them is building a rapport. Because the reason why they're having mental illnesses or mental disorders is because that there's something that they have not got, or maybe they're lacking something in their life, or maybe they're facing some trauma. So probably they will not reveal these things to you if you don't have a very good rapport. So the first and foremost thing is accepting them unconditionally, being non-judgmental, and giving them the warmth, affection, love, care, and also empathizing, build a rapport with them. So once you build the rapport with them, definitely they will open up their problem to you. So you have to create such a close rapport so that they will try to transfer whatever inside them. So I think that's the best way to deal with school kids, because school kids, they're very vulnerable, and they can quickly get affected because of their vulnerable state. So we need to make them strong. We need to encourage them. We need to motivate them to open up. So once they start opening up, I think probably at that point you will be able to win their trust and build a rapport so that they will do what you say. So that is one thing that you could do, but it's a very broad question that I have, confined it and given you an answer. So the first thing is you need to build a rapport and make them to talk to you and give a good listening, active listening, so that they know that they are heard. That's the best. Hi, Isaiah. Yeah, Isaiah, that is what we have been talking all this time, I guess. So that's what. It's not only about deviance, it's not only about distress. That's why I said that there are four factors which you need to focus. So one is deviance, one is distress, and then maladaptive behaviors and maladaptive thoughts and inability to cope with day-to-day functions. You have to be focusing all these factors. Yeah, so you have to be focusing on all these factors. It's not only about deviance and it's not only about distress, but distress and deviance, these two are two indications of mental health disorders. But also, if you could see the person is having maladaptive behavior and thoughts, the person is finding very difficult to cope with day-to-day functions, and also shows some sort of a deviance, then probably it's an indication.
Thank you so much, ma'am, for your answer. Ma'am, our
Okay.
next question is from me. Good day, everyone. Good day, ma'am. Hajara Satam. What causes deviant behavior? How is
Yes.
deviant behavior controlled by family? Thank you.
Hi, Floppy. It's a really good question because there's not like one factor which leads to deviant behaviors, but there can be so many factors. Like there are certain mental disorders which leads to deviant behaviors, and insisting so much of rules and having negligence, having abundance, physical, sexual, and verbal abuses during the early ages, that also could lead to deviant behaviors. And also, unmet desires, like according to psychodynamic approach, we say that there are certain desires in our unconscious mind which leads to deviant behaviors. It could be a conflict between ego, superego, and id. So that could lead to deviant behavior. Sometimes the deviant behavior can be learned. Probably they see that somebody else is doing and they are modeling it. Yeah, and also it could be because that they don't have a good purpose in their life. There can be a discrepancy between their real self and ideal self. They don't know how to cope with it, or maybe due to extreme stress factors, due to excessive stress. So there can be so many causes, but the family support is very much important. As you said, if you're seeing some sort of deviant behavior, it means that you need to pay attention there. That needs to be attended. So you need to pay attention. You need to be very, very patient with that person rather than being very rude and arrogant. You need to be patient. You need to give them a very warmth and give them a lot of hearing, and just see what is the cause of it. Because cause can be varied. There are multiple causes. There's no one or two. There can be multiple causes. Sometimes it can be their personality. It can be because of the trauma that they have gone through. Maybe they're going through some sort of a bullying. Maybe they're going through some sort of stress in their life. So there can be multiple issues. So you need to listen to them, and you need to spot out the cause of their deviant behavior first. Only once you find out the cause, as a family member, you will be able to give that support. Conformity, yes, conformity could be a cause of deviant behavior, Saya, but it's like one out of multiple causes. Conformity is one, and trying to get the approval of others, try to be very attention seeking. So there can be multiple causes. There's no like one cause. So it's a combination of factors. Is that all?
Thank you so much, ma'am, for your answer. Ma'am, our next question is from Ishaya. Is conforming a cause of deviant behavior?
Yeah, I think I answered that question. Yes, that could be a cause. That's what I said. Yeah, I
Ma'am,
answered
I
that
think
question.
there is no more questions from our participants after
Okay,
your
thank you
beautiful
so much.
presentation.
Thank you so much. Thanks a lot for all the support that you have given with the presentation. I hope you guys enjoyed and learned a lot. Thank you so much for the opportunity.
Welcome, ma'am. Once again, thank you so much, Honorable Ma'am, for your time in IGP. We have learned a lot from you with new topics. It will add some value to our day-to-day activity along with our academic and professional growth. Honorable Ma'am, hope to see you again with a new topic and a new day. Thank you, ma'am. Take care.
Thank you so much. Bye. Take care.
Honorable Ma'am,
Yes, dear.
before we move to the next webinar certification process, if you want to leave this studio, you can, ma'am.
Ah, okay, dear. So I'll leave anyways. Thank you so much. Thanks a lot.
Welcome, ma'am. IGP Knowledge Seeker, it's time for the webinar process. Webinar certification process, the most attractive and powerful part of our regular webinar. After a short video, we will start our webinar certification. After webinar certification, we have an online quiz competition and quiz certification. IGP Knowledge Seeker, it's time for the webinar certification process, the most attractive part of our regular webinar. After a short video, we will start our webinar certification. After webinar certification, we have an online quiz competition and quiz certification. and code is IGP4932 and the code is IGP4932. Without code, no one is eligible for certificate. With code, you can claim your certificate anytime. How to claim an e-certificate? Go to www.eduigp.com, click sign in, log in if you already have an account, or create a new account if you are new. Once login, click free webinar, select the webinar title and click continue course, get enroll if you haven't enrolled yet. Type the code in your certificate code box, click get your certificate. It is auto downloaded in PDF file already. Just check it in your file manager or download folder. Don't forget to leave a review in our FB page, website, and in Google. Dear IGP Knowledge Seeker, it's time for the webinar certification, the most attractive part of our regular webinar. After a short video, now, time for the online quiz competition. To join the online quiz competition properly, please follow my instruction carefully. Now, time for the online quiz competition. To join the online quiz competition properly, please follow my instruction carefully. Go to www.slido.com and find today's quiz or scan this QR code for direct joining. Quiz code is afternoon. After a short video, we will start our quiz session. Don't forget to mention your friend to join our quiz session. Hmm. Please join in Slido with the code and the code is afternoon. Please join in Slido with the code and the code is afternoon. Please join in Slido with the code and the code is afternoon. Please join in Slido with the code and the code is afternoon. Please join in Slido with the code and the code is afternoon. With 34 people, we are going to start our live session right now. Our first question is, the two most common treatment for mental disorder are medications and hospitalization. Option 1 true, option 2 false. Option 2 false, right answer. 31% people are right here. In the leaderboard, Joel is holding the first position. Our second question is, the textbook discuss two basic approaches that can be used to treat clients with mental health disorder. Option One, dream analyze and electroconvulsive therapy. Option two, psychotherapy and biological therapy. Option two, psychotherapy and biological therapy is the right answer. 76% people are right here. In the leaderboard, Joel is holding the first position. The third question is mental disorder may affect between 15 to 20% of Canadians. Option one false, option two true. Option one, option two true is the right answer, and 55% people are right here. In the leaderboard, Joel is holding the first position. Our fourth question is a physiotherapist can diagnose and treat mental disorder and also prescribe medication. Option one true, option two false. Option one true is the right answer. 91% people are right here. In the leaderboard, Joel is holding the first position. Our fifth question is collectively and all diagnosable mental disorder is known as what? Option one mental illness, option two mental health problems. Option one mental is the right answer. 24% people are right here. In the leaderboard, Joel is holding the first position. Our seventh question is according to the Dietrich stress model, mental disorder are caused by both. Option one, a prediction to mental illness and stress. Option two, unconscious conflict and stress. Option one, a predisposition to mental illness and stress is the right answer. 88% people are right here. In the leaderboard, Joel is holding the first position. Our seventh question is complex neurodevelopment disorder of brain functions range from mild to severe. Two behavior dominance affected are all. Option one ASD, option two ADHD. Option one ASD is the right answer. 28% people are right here. In the leaderboard, Joel is holding the first position. Our eighth question is the most common mental disorder is teenage girls are eating disorders. Option one false, option two true. Option one false, right answer. 44% people are right here. In the leaderboard, Joel is holding the first position. Our ninth question is mental disorder are psychological problems that are often caused by poor nutrition. Option one false, option two true. Option one false, the right answer. 48% people are right here. In the leaderboard, Vinaranda is holding the first position. Our last and final question of afternoon session: medication for mental disorder are used to manage negative symptoms. Symptoms. Option 1 true, option 2 false. Option 1 true is the right answer. 77% people are right. Our top 10 tuition winner. Congratulations again. Slide will take a few minutes for finalizing the result, and after that, we will issue our online quiz competition certificate on our official Facebook page and group, Institute of Global Professional. Congratulations to our online quiz competition winner top 10. Congratulations again. Slido will take a few minutes for finalizing the result, and after that, we will issue our online quiz competition certificate on our official Facebook page and group, Institute of Global Professional. Congratulations to our online webinar quiz competition winner top 10. Congratulations again. Slido will take a few minutes for finalizing the result, and after that, we will issue our online quiz competition certificate on our official Facebook page and group, Institute of Global Professional. At the end of our session, we can say properly feed is skill, never stop learning, cause life never stop teaching us. Be happy and stay safe. See you again and again. We want your participation in every program. If you want to live a happy life, tie it to a goal, not to people or things. Albert Einstein. Before I say or hit the end like button, once again, thank you all IGP knowledge seekers for your active participation as always. See you again in the next session. Thank you.